National briefing on COVID-19. Today is Monday, 11th January 2021, and today marks the third day in the new year on this briefing. The chairman of the task force on COVID-19 and the Secretary to the Government of the Federation, honorable ministers and members of PTF, our esteemed listener and viewer at home and abroad, gentlemen of the press in the hall covering this event live, it's a pleasure to welcome us to today's national briefing. May I please, at this point in time, invite the chairman of PTF, who is also the Secretary to the Government of the Federation, for his opening remarks. SGF, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, our sincere apologies. We wanted to get this started by 5 o'clock, but we had a lot of grounds to cover. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for today, Monday, the 11th January 2021. Reports coming in from all over the world show that COVID-19 pandemic is still wreaking huge havoc on humanity, economies, and systems. The situation report as of Sunday, the 10th of January, point in the following direction. On 8th of January 2021, 833,496 cases were recorded. This represented the highest ever since the pandemic started. The 3 days preceding the 8th, each recorded over 700,000 cases. Global cases have now reached 90,676,320 mark. Global fatality count is fast approaching the 2 million mark. The global global CFR has declined from 2.2 to 2.1%. The CFR for Africa has also declined from 2.3 to 2.2%, and the World Health Organization African region crossed 2 million case mark on Wednesday, 6th of January 2021. In Nigeria, we have crossed, unfortunately, the 100,000 mark and now rank second in the number of new cases, the 4th in cumulative cases in Africa, and the 5th in cumulative deaths. Last week, Nigeria recorded over 9,000 cases, over 9,000 cases in 1 week. You remember in week 53, we recorded about 5,000. But in the first week of January, over 9,000 cases. You know for sure that that number, because of our poor record management, you can be rest assured that that does not reflect what actually is on the ground. Realistically, if we estimate the numbers missed, we will be in a much higher region. There is no state in Nigeria that is immune to this pandemic, even if reports are not coming out of such states. The Honorable Minister of Health and the DG, Nigerian Center for Disease Control, will expand on the statistics during this briefing. It is, however, very instructive to stress that factors that have contributed to rise in numbers from late November 2020 included increased local and international travels, business and religious activities, reopening of schools without strict compliance with COVID-19 safety measures. The full import of the foregoing is to press further on the need for us all to elevate the level of our vigilance and compliance with the recommended non-pharmaceutical interventions. The current wave of infections is swift and virulent, and we do not know how long it will last. Besides, the facilities available for treatment of critical cases remain very limited, and we do not wish to be overwhelmed. But the indications are in that direction. Your best bet, therefore, is to avoid infections completely. The Presidential Task Force has continued to receive inquiries about the issue of testing before traveling out of Nigeria. For the avoidance of doubts, the protocol in Nigeria requires inbound passengers to test not more than 96 hours before boarding flights to Nigeria. However, for passengers leaving Nigeria, it remains the responsibility of travelers to confirm the requirements of the country of destination and that of the carrier of choice. The national coordinator will clarify the extant protocol and the policy position. For inbound travelers, a new protocol on pre-boarding has been released and compliance is strictly recommended. The additional requirements for passengers coming from the United Kingdom and South Africa also remain in force. The national coordinator will also speak on this during this briefing. Next week, the pilot exercise on the use of the rapid diagnostic test kits, RDTs, will be rolled out in 5 tertiary health institutions in Abuja. The DG, Nigeria Center for Disease Control, will expand on this. The isolation of different strains of the virus is being vigorously pursued. In this regard, the PTF is working with the Africa CDC and the Nigerian Center for Disease Control on the sequencing of the COVID strains circulating in Nigeria. We shall keep you informed as the exercise progresses. As part of measures to deepen community engagement and enforcement of protocols, the Presidential Task Force met with the Nigerian Governors Forum last week, operating under the auspices of the National Economic Council, and will be meeting with key religious and traditional leaders very soon. It will similarly meet with security agencies to seek their cooperation with enforcement protocols. The third stream of NYSC members will resume on the 18th of January, and the PTF is working closely with the management to ensure that participants are tested and protocols are complied with. Finally, the PTF has advanced the preparation for the management of all aspects of vaccines discussed. Particularly, lessons are being drawn from other jurisdictions on the successes and the challenges of the vaccine administration. The Executive Director of the National Primary Healthcare Development Agency would elaborate on matters of vaccine and vaccine administration, as well as dealing with misinformation, conspiracy theories, and disinformation. I now invite the Honorable Minister of State for Health, thereafter the DG, NCDC, and the National Coordinator to brief you from technical perspectives. I thank you for listening and have a very pleasant evening. Thank you.
Mr. Chairman of the PTF, my colleagues here present, media representatives, distinguished ladies and gentlemen. We have now crossed the 100,000 mark for confirmed cases of COVID-19 and evidence of increasing infection. As of this morning, 100,087 cases have been confirmed, while 80,030 cases have been discharged since this pandemic began. We have also sadly recorded 1,358 deaths in 36 states and the Federal Capital Territory. In the last 24 hours, 1,024 new confirmed cases were recorded in 17 states with 8 deaths. The case fatality rate stands at 1.36%. So far, we have tested a total of 1,025,560 people with a positivity rate of 9.8%. Our testing rate in the last few weeks has increased as we continue to engage states to scale up their case finding and testing. We are working to meet our target of testing 2 million Nigerians within the shortest period. The result from the tests conducted on prospective NYSC members has incontrovertibly confirmed that no part of the country is free of COVID-19 disease. We safely and comfortably draw this conclusion because core members are mobilized from all the states of the country for each of the orientation camps. With the increased number of cases, the number of active cases has increased expectedly. As of today, we have 18,699 active cases on treatment, both in facilities and in the community, using the treatment protocols. Many of the active cases may require care in one of the treatment or isolation centers, thus imposing enormous burden on our facilities. The report that many of those who died reported late for treatment at the approved centers because they were referred late from private facilities is alarming. We therefore once again seize this opportunity to urge healthcare practitioners to promptly send all suspected cases for testing and when positive, refer them to isolation centers for treatment. Attempting to treat suspected or confirmed cases not only exposes the health workers in such a facility to risk of infection, but also denies the patient early access to effective treatment in an approved treatment center. The plan of the federal government regarding activation of oxygen availability in the states is on course, with a view to effecting immediate repairs of non-functional oxygen plants. The weekly Case Management Partners Coordination Forum for 2021 is set to recommence on Wednesday, 13th January 2021. This is an avenue for continuous interface with different actors in case management towards engendering experience sharing. Finally, we are all reminded again that COVID-19 is real, but preventable. While we await the vaccines, we are enjoined to observe all non-pharmaceutical measures. Wear your face mask appropriately, especially when out of your house. Wash your hands with soap and water regularly, or use hand sanitizer where necessary, and avoid unnecessary travels. Permit me at this juncture to specifically emphasize the need to avoid crowding, as we see in people under the guise of national identity number enrollment. There is absolutely no cause for this, if only people would voluntarily comply with advisories and guidelines as issued by the Ministry of Communications and Digital Economy and its relevant agencies. The statement credited to me on the social media as to the suspension of the exercise is out of context, hence totally misleading. For the avoidance of doubt, Mr. President's order on the matter remains as being carried out by the relevant ministry. I'm also aware that the relevant agency normally invites people in order to create order. And the only reason for such invitation is for data capture or fingerprint capture. That is what I have as my understanding. And besides, the Honorable Minister made a elaborate presentation on this issue, I think last Friday. And all the Honorable Minister of Communications and Digital Economy said still remain. Distinguished ladies and gentlemen, I thank you for listening.
Of the Federation, honorable ministers, WR, directors, colleagues, gentlemen of the press. Thank you very much again for attending. Yesterday, we were reminded of the stark reality that we live in now. We are now living with a virus that has now affected 100,000 lives in Nigeria and well over 1,300 deaths in 11 months. And probably there are many more. That's what we've been able to confirm. The virus that causes this disease, COVID-19, is spreading very fast, causing mild symptoms in some and severe symptoms and death in others. And many people continue to experience fatigue and some symptoms even after recovery. So this disease in many people doesn't end after 2 weeks. There is a silent face to COVID-19. You cannot tell whether someone has had the virus or not. Yes, we have educated everyone on the most common symptoms, but there are also very vague symptoms of weakness, slight headache. So we are encouraging everyone to have a much higher index of suspicion. And also healthcare workers to don't waste people's time treating and looking for malaria and typhoid and so many other possible causes of illness. The strategy now should be to rule out COVID-19 before you go for the others. So test for COVID-19 is very easy to do so now. All the testing centers across the country are active. Their locations are on our website. ncdc.gov.ng, you can find any testing center across the country. Some places have more than others, yes, but there are testing locations across the country. If you feel weak, if you feel you have a bit of fever, headache, any of those vague symptoms, please, before you go testing yourself with rounds and rounds of antimalarials, do that COVID test. It may save your life and the lives of others. So again, we're asking people to take some responsibility around the activities we're engaging in. When we say people should take responsibilities, when you organize a large gathering where people are invited, some people are invited and have a choice. Many others do not have choices. The people that work in these places don't have a choice on whether to come or not. They have to work. And therefore, if you're managing a facility where people are invited for a wedding and the place is full and heaving with people, at least there'll be many staff that are serving there that don't have a choice. So by doing that, you're exposing them almost deliberately to this virus and potentially to death. So we must all be aware of the consequences of the decisions that we're making. We're reaching a critical level with our hospital capacity in many towns in Nigeria. We must begin to protect our most vulnerable as we get deeper into this phase of the outbreak. While we may all be tired, remember this virus is not tired and is taking advantage of our tiredness and our fatigue. So again, I advise Nigerians to stay at home as much as possible, avoid large gatherings, especially indoors, with poor cross-ventilation. 100,000 cases are not just numbers. There are fathers, mothers, brothers, sisters, children, whose deaths we will all mourn, and the pain of their loss felt deeply. So at NCDC, we're committed to going over and beyond. Healthcare workers are working across the country to ensure that the response is sustained, while our colleagues at MPACD are working very hard to drive access to vaccines as soon as possible. We must continue doing the bits that we've been doing over the past 11 months. To elaborate a little bit more on what the chair said, we're rolling out the use of RDTs in 5 tertiary hospitals in Abuja from Monday next week. This will increase access to testing. We then intend to roll out across the rest of the country from February. This will make testing a lot more available to hospitals, both for healthcare workers themselves and patients coming to these hospitals. You will also remember that we used RDTs in NYSC camps across the country. We found that in every state in Nigeria, we tested people coming from different states, and we found positives among individuals that had reported to NYSC from every state in Nigeria, every single state in Nigeria. So there's no state that is spared of this virus. We would have been surprised if there were, but our data suggests that we are right in saying that there's COVID circulating in every single state in Nigeria, and we all have to continue the hard work that we're doing. So finally, we continue to count on government, religious and traditional leaders, our partners, the private sector, business owners, gentlemen of the press, but perhaps more importantly, or most importantly, all Nigerians in their individual capacity to help us control this phase of the outbreak as we all work diligently towards access to a vaccine. Thank you very much.
Gentlemen of the press, good evening. So first of all, I would like to note that security agencies have ramped up enforcement of non-pharmaceutical interventions and compliance with our protocols, especially in the FCT and Lagos, which remain centers of the epidemic. Some entertainment centers have also been closed, defaulters arrested, and prosecuted in mobile courts. We would like to thank the state governments for doing this, but we are asking them to do even more to make sure that our protocols are complied with. This is the only way we can sustain and keep the country safe from COVID-19. The National Orientation Agency has also continued to have sustained engagement with Nigerians on its social media platforms to clear misgivings and disinformation surrounding the COVID-19 vaccine. This effort is the latest in a series of sustained awareness campaigns by government agencies to encourage the acceptance of the COVID vaccine when it becomes available. The PTF would like to commend this, particularly given the subsisting misconceptions by some segments of the population concerning the vaccine, and we hope this will continue to be sustained. The DG NCDC has already mentioned the issue of management of cases. It's very important that our healthcare workers realize when somebody presents with a persistent fever, especially if there are respiratory symptoms or a shortness of breath, it's possibly going to be COVID. So we are asking the general public to have a heightened sense of awareness. Not every fever is malaria or typhoid. And if you're coming with a respiratory symptom, cough, or shortness of breath, or you have lost your sense of smell or taste, it's more likely to be something else, and get yourself tested for COVID because it could save your life. Again, we will keep on talking about the need for vulnerable persons to please stay at home. If you are above the age of 60, if you have diabetes, if you have other comorbidities, you're the person that COVID is looking for in order to cause harm, significant harm. So while we are not in lockdown mode, it's in your best interest if you fall within this group to lock down, because now is the time to actually keep away from the general public. Now is the time to keep away from mass gatherings if you fall within this group, because if you catch COVID, you could end up competing for limited oxygen supply or a ventilator. Our beds are fast filling up in our treatment centers, and you don't want to be in a position where a decision is being taken as to whether or not you should go on oxygen or a ventilator. The PTF will also be reviewing, we're currently in the process of reviewing our protocols. We've had discussions with state governors, including a review of curfew hours, particularly with the aim of addressing and sniffing out the issue of nightlife and entertainment, which is also driving the current numbers. And once this review is completed, an announcement will follow with regards to the curfew. In terms of international travels, we would like to provide additional clarification. So from today, Monday, the 11th of January, we have changed the validity of the COVID PCR test for those travelers, international travelers that are outside the country. You will need to present a PCR test that is negative and valid within 96 hours, not 120 hours, 4 days or 96 hours. If you present a COVID PCR certificate or result that has a validity more than 96 hours to the time of boarding, you will be denied boarding, and the airlines have already been informed. From today, it will also be necessary for you, if you are traveling into the country, to use the travel portal, fill in your health questionnaire, and upload your COVID PCR result, and print out your permit to travel or QR code. If you do not have a permit to travel, you will be denied boarding. And this is especially so for passengers coming from the UK and South Africa. You have to pay before you board for Nigeria. If you do not pay, the airlines will not allow you to board. As usual, we are discouraging all non-essential international travel, but if you have to travel, if it's essential for you to travel, please familiarize yourself with our travel protocols. For passengers leaving Nigeria, not every country requires a COVID PCR test. So it is your responsibility as a passenger to check with your airline or with the embassy of the country you are traveling to. If you do not require a COVID PCR test to travel out of the country, you don't need to bother. Do not engage with touts. Do not allow yourself to be siphoned of your hard-earned money. Travelers are cautioned to avoid third-party arrangements for their registration and/or payment for the PCR test. The government has not authorized any agent or body to carry out registration and/or payment for outbound travelers on our behalf. Please do not pay any third parties. Use the portal and pay directly, or go to a private lab to get your travel test. Tests outside travel are free. So public health, if you are testing for COVID within a public health setup, you should not be charged. But if you are traveling, you will have to pay for it. Please note that we are at the moment looking for passengers that are presenting COVID-19 PCR tests that are fake. If you take the risk of presenting a fake certificate and you are caught, you will be prosecuted. And not only you, but we will also find out the source. We have additional check mechanisms at the moment that we are implementing at the airports to stop this from happening. It's also important to note that inducement of Port Health Service staff or other airport staff is strictly prohibited, and defaulters will be liable to prosecution. Finally, just wanted to say that we cannot afford to continue to put our country at risk. We will continue to monitor compliance with our travel protocol and all our non-pharmaceutical interventions. We have already begun to sanction defaulters with the first 100 passports facing restriction, and this week we will be finalizing the next list of 100 passports that would have travel restrictions placed on them. And we will continue to do this every week until we note an improvement in our compliance measures. I urge all of us to take responsibility for our health and for the health of our loved ones. We should wear a face mask when in public. We should use a hand sanitizer and maintain our physical distance. Thank you.
Nigerians have been concerned about the use.
The National Coordinator, honorable ministers, members of the Presidential Task Force, distinguished ladies and gentlemen, good evening. Today I'm giving just a brief update because if you recall, on Friday, we had a very rich engagement with people from different sectors of the media, and you guys were there as well. So I want to first and foremost acknowledge and appreciate your contributions. You had very, very exciting questions. You raised your concerns in a very transparent manner, and you were also able to use the opportunity to provide guidance to the PTF, to the Federal Ministry of Health and the National Primary Healthcare Development Agency around how we can strengthen our communication around COVID-19. So we came away from that meeting really, really enriched by the conversation. In terms of the work that we're doing around providing better information about COVID-19, we're using exactly the same templates that the Presidential Task Force has been using in the last few months. So we're not reinventing the wheels. There's no need changing a team that is working well. We recognize the fact that because of the work of the Presidential Task Force, and to a great extent, the work that you guys have been doing, we've been, for the most part, been able to communicate the right information about COVID-19. we're using the same channels to convey information about COVID-19 vaccines. There's nothing that is cloak and dagger. There's nothing that is hidden. And from our conversations, what we are beginning to see, even on social media, is that Nigerians are beginning to get the facts. We've disseminated frequently asked questions, and in different platforms, we're beginning to see people are asking questions, and even without us responding, we see Nigerians responding on our behalf because they know that the spirit of the Presidential Task Force is to see how we can, as much as possible, flatten this curve and get back to near normal ways of living. We continue to work very hard at the operation to try and meet the operational and regulatory requirements to access safe and effective vaccines. We are also watching the space, looking at what other countries are doing. As you are well aware, the Americans, the British are struggling to meet up with the coverage that they've earmarked for their citizens. Potentially because for a very long time they've not rolled out vaccines in campaign mode. While we learn from the best practices out there, we're also going to contextualize all of the great lessons we've learned from the polio eradication program, and we're going to be bringing it to bear as we roll out the COVID-19 vaccines. I know there are questions from people in the media that how can we possibly vaccinate as much as 40% of our population within 1 year? I'll assure you that this is feasible. As long as the resources, the vaccines come in on time, we should be able to deliver on that target. Only in the month of October 2020, last year, we were able to reach as many as 23 million children under 5 with oral polio vaccines. We know that it's not exactly the same, but we do have the personnel that needs to be trained and retrained, and we do have the experience, and we have frontline technology that we're going to put to use when it comes to COVID-19 vaccines. There are questions around, why we're not producing the COVID-19 vaccines in Nigeria. I want to just put on record that the process of producing a vaccine is very complex and complicated. You don't just go to a shelf and pick up a vaccine. So it requires massive investments that have not been done for many decades. In the past, in the 1960s, I want to reiterate that we used to make yellow fever vaccines in this country. In the 90s, we took a decision to change our analog ways of making the yellow fever vaccines into the most recent technology. However, that transfer of technology never happened, and that is why we did not continue to make yellow fever vaccines. Perhaps if we had continued making yellow fever vaccines in the Yaba laboratory in Lagos, it might have been easier for us to continue and make other vaccines before now. So there is a genuine effort by this administration to restart the process of vaccine production. This is why the federal government went into a partnership, a joint venture agreement with BioVaccines through May and Baker. It takes usually 10 to 15 years for you to be able to start producing the vaccine. So it takes a very long and complicated process. But like they say, the journey of 1,000 miles begins with one step. And those steps have been taken by the federal government by getting into this joint venture and making sure that those partnerships with pharmaceutical companies have already started. I am a member of the BioVaccines board, and I know that the Honorable Minister of Health and the Federal Minister of Health is committed to making sure that we now drive the efforts that will make sure that in the not too distant future, we will be able to produce vaccines in good time. But the COVID-19 pandemic has come a shade too early for us to be able to produce the vaccines immediately. However, it does not stop our research institutions from learning all of the process that has led to such a rapid production of COVID-19. The questions that people also ask, and this is one of the reasons why people have concerns about COVID-19 is that how come it's taking decades to produce malaria vaccine? It takes several years to get to produce other vaccines. How come it's taking less than a year to get the COVID-19 vaccine? Two very, very important reasons. Number one, this is the first time ever that we're producing a messenger RNA vaccine. Messenger RNA vaccines are usually faster to produce. Secondly, the folks that developed the COVID-19 vaccine did not start from ground zero. What it means is that there were precursor vaccines that were already in the laboratory. If you recall that in the late 2000s, we had the outbreaks of SARS. So there were so many scientists, so many companies that went into potentially working on the vaccines, because these are very similar viruses. What has happened is that because of all of that effort, people now invested money with the outbreak of COVID-19 to make sure that some of those precursors are fast-tracked to getting this vaccine. So it wasn't like the vaccines were just willy-nilly produced overnight. They went through a very, very rigorous process. I like to liken the production of the COVID-19 to what it takes, for example, to prepare bean cake, right? So if you want to prepare maybe moi moi, or is it kosei or akara, right? You could decide that, okay, I want to eat kosei, akara, or bean cake maybe next week. You've not taken the decision as to whether you want to take moi moi or whether it is kosei, but you know that you want to take a bean product. One thing that you can do to fast-track that process is both the moi moi and the kosei require you to wash the beans, to grind it, right? And then the final process is either you just cook it in a pot for moi moi, or you fry it in the case of kosei or akara. So what has happened in semen analogy is that you have washed the beans, you have grinded it, but you are yet to take a decision. You put it in the freezer or the refrigerator. When you now take the decision that you want moi moi, then you quickly cook it in a pot with water. If it is kosei, then you fry it. So evidently, the time it will take for you to move from the grinded bean cake to frying or boiling in a pot will be shorter. This is exactly what happened with the COVID-19 vaccines. The precursors were already in the laboratory. They came and a pandemic. People invested money and cut short the processes. There's nothing about some wicked conspiracy theories about the COVID-19 vaccines. And I'm happy to see that Nigerians are beginning to get that. And on our part, as the Presidential Task Force, we will continue to be patient, to listen. We will not dismiss those concerns, but we will work very hard to provide the information that is required to assure Nigerians that in the spirit of integrity and ethics, we will only approve vaccines that are safe for all Nigerians. Thank you very much for this opportunity.
Thank you very much, Executive Director, National Primary Healthcare Development Agency.
Dear Oron from AIT, I would like to start with the DG of NCAA. Well, I'm aware that 4 billion naira have been released to airline operators to cushion the impact COVID-19 have had in that sector. But I'm a bit worried because there seems to be disagreement among some of these airline operators on the sharing formula. So I want to know, is there any measure the Ministry of Aviation have put in place to monitor how these monies will be spent so that Nigerians can benefit the dividends while it was released? Second question is to the Minister of Education. So my question is for you. Well, the NUC have mandated tertiary institutions to resume, I think on the 18th of January. I want to know, sir, looking at the fact that our numbers are rising, there's increase of infection among the youth, have you taken your time to tour the school to know if they are COVID-19 compliant? I want you to tell us that. And my third question is to the DG of Primary Health Care. Well, you have mentioned that 40% of the population will be vaccinated this year alone. Well, I don't know if that is a target because we've had so many targets even in the PTF and it hasn't been met. And most of the vaccines we're expecting is from COVAX. But I want to know, aside the COVAX facility, what other measures are we putting in place? Because we've seen countries like South Africa that are receiving over 1 million doses of these vaccines, not from COVAX, but from the ones they have paid, which will be arriving very soon. And you said there are talks with some countries on how we'll get vaccines. But we want to know the timeline. How long would this talk take? Because just in week 52, we saw that we lost about 57% in 1 week. So we want to know, what is the time frame like? Then secondly, still staying with you, I want to know, some of these vaccines, I know now you've said that there are people that are of priority when these vaccines come. Well, I'm particularly concerned about the state, because so many times the PTF have come up with guidelines on how this response should go, but the state will tell you, but we do not take orders from the center. So are there measures of how these vaccines will be monitored when it goes to the state? Because the state can decide to say, oh, the health workers are not our priority, it could be their family members. I want to know that. And number 3, still staying with you, sir, after taking these vaccines, for the persons who will be fortunate enough to take them, does that mean they do not need to wear their mask, they can stay in gatherings, they are immune from contracting the COVID vaccine? The infection, thank you.
Good afternoon, members. Good evening, members of the PTF. My name is Juliana Taiwo Balonye of the Sun newspapers. My first question goes to the SGF, sir. You admitted in your remarks that one of the factors contributing to the rise in number of cases include increased local and international travels. Why has FG not imposed flight ban in the UK? Why has the federal government yet to impose flight ban on the UK and US, despite the fact that most of the cases are coming from there? My second question is for the national coordinator. I know you said earlier that we are not in lockdown mode yet, but is the PTF considering a second lockdown? That's the rumor out there. And do you think the country can survive another lockdown? My last question is for the ES primary health care. How do we plan to raise funds to get the vaccine? Thank you.
Good evening, the SGF. Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa, and I report for Voice of Nigeria. My question is for the Executive Director, National Primary Healthcare Development Agency. So as we await the arrival of the vaccine, we have seen so many messages on the social media on misinformation and disinformation about the existence of COVID. So beyond this briefing, we had a robust Zoom meeting with you last week. Beyond all this, are you looking at a strategy to enforce the use of vaccine when it arrives, should people resist compliance? Thank you.
Good evening. My name is Gloria Umezuke from Channels TV. My question is for the Minister of Health, State for Health. You dropped a hint earlier today about the possibility of a postponement of NIN registration. Can you clarify that, please? Are you planning to ask NIMSI to put a hold on this? Thank you.
Good evening, all. Rachel Abuja. My first question is for the Minister of Health. Sir, Nigerians would like to know the impact of COVID-19 in the health sector for 2020. And my next question is for the WHO rep. We would also like to know what WHO is saying about airborne of COVID-19. Thank you. Airborne transmission.
My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My first question is to the Minister of Environment, sir. Prior to the opening of Unity schools back, there was this fumigation and all these things before the reopening of the schools. Now that the ASU is citing non-compliance of COVID protocols, or the universities are not ready for COVID-19 because of COVID-19, is there any similar exercise to deploy all these environmental officers and all you have done previously. My next question is, anyway, thank you very much.
Okay. Hey, go and drink water.
Good evening, Chairman and members of the PTF. I am Mitaire Ikben. I report for the NTA. My first question is for the Minister of Education. Nigerians want to know if the January 18th school resumption date is sacrosanct, or there might be extension of the holidays if COVID-19 cases continue to rise. And for the Executive Director of the National Primary Healthcare Development Agency, what is Nigeria spending to acquire the vaccines for this year and next year? Perhaps if Nigerians also know the cost and the value of the vaccines, they will appreciate it. And for the DG of the NCDC, Nigerians want to be reminded how many times can people who have survived COVID-19 get reinfected? Thank you.
Today is a hot day. We have a basket of questions. Well, let's start with the Honorable Minister of Education, Madam Adama Adamu.
And gentlemen of the press, I think two people asked about the January 18th date, so I think I'll give them one answer. The last one was asking whether it is sacrosanct. I think it is not sacrosanct. When we decided on that date, it was just a target towards which we were working. And of course, we are keeping it in view and looking at what is happening in the society. And then it is supposed to be subject to constant review. Even today at the PTF meeting, we looked at the rising figures, and probably we thought we should take another look at it. And the first questioner, I can't remember exactly what she said. She was talking of what ASU said. Of course, once we decided on the protocols and we sent them to school, there have been monitoring teams that have been reporting to us. That is not the aspect of your question that I wanted. I thought you talked about January 18th also? That's what I'm saying. We are reviewing it. We are going to review it. Thank you very much.
As a matter of fact, we have done some kind of decontamination and disinfection on, I think, 2 or 3 universities on request at the time. So we do have the plan to do that. All we are waiting for is to just know when, all this thing will be settled and the schools will reopen, because the timing for decontamination and disinfection is critical. So we do have a plan to do that. Thank you.
How many of states for health?
Thank you very much, Mr. Chairman, my colleagues, and media representatives, distinguished ladies and gentlemen. The first question was from Gloria Channels. Gloria Mezoke from Channels. I tried to address the issue as to whether there is going to be a suspension or postponement of NIN enrollment. I think that was your question. And I made it clear in my earlier presentation that that was, it was taken out of context. There has been no decision to that effect, and there will be no decision to that effect except it's coming from Mr. President. All of us, ministers, aides, and what have you, we are working for Mr. President to make possible his agenda for this country. And there wouldn't even have been need for this crowded approach, which is fundamentally, I repeat, fundamentally due to the attitude of our people. It's an attitudinal issue. At no time did the Ministry of Communications and Digital Economy or its relevant agency ask people to come the way they have been bombarding the centers. At no time. But because of this attitudinal defect of our people, they, on their own, decided to do what is going on, of course, which we are not comfortable with because it might as well be a super spreader event. What I know is that the only thing that people need to come for is the capturing. And the guidelines and the procedure for that have been properly put in the media's, in the public space, so as to ensure orderliness. So there is no reason for what is going on under the guise of wanting to get enrolled under name. So I'm saying emphatically that it is only Mr. President who can issue any order aside what subsists right now. And what subsists is that the exercise has been concluded, and those who are unable to meet up is just too bad, because the issues involved in this exercise border on national security. And when you are talking about national security, every and any other issue takes the back seat. What we are seeing in terms of Boko Haram, kidnapping, banditry, to a large extent, this issue of abuse of the telephone is a major component. So, it's only Mr. President that has the power and has the mandate to do or to say otherwise. As at this point in time, there is no consideration to that effect of suspending or postponement in any form. And my advice to our people out there is to try and comply voluntarily. Voluntary compliance in the interest of all of us. We want everyone to keep safe. We want everybody to keep well. So we're saying that the issue of people going there on their own to crowd up the place is not in the best interest of what we are fighting at the moment, which is COVID-19 pandemic. I hope I've made myself clear. Thank you very much. The second question is from Rachel. That is Voice of Nigeria, or NAN. I don't know why I always think you are from Voice of Nigeria. NAN. You were asking the impact of COVID-19. The impact of COVID-19, you can look at it from two perspectives, positive or negative. Because what experience has shown is that even in a seemingly bad situation, you can still get some positive things out of it. So I will start with the positive. The positive, first, is infrastructural expansion in the health sector. hospitals, wards, isolation wards, ICU, and of course, laboratories. When COVID-19 pandemic started, even before it became a pandemic, I think we had just about 3 or 4 molecular labs. But as of today, I think we have well over 80 or thereabout molecular labs. So that is positive. The same goes for ICU, intensive care units. Some of the centers, if not many of our centers, did not have intensive care units. But as of today, we have quite a number that are functional. The same thing goes for even the general wards. Some have been expanded to take more patients. Number 2 is the issue of human resource for health. Because if you are expanding the physical infrastructures on ground, you need human resource for health to cope. Like in the laboratories and the hospitals, you need all the health workers, the doctors, the nurses, the medical laboratory scientists. You need everyone. So you will necessarily increase, that is, you will employ more people. And you recall that at some point in time, we did say here at the PTF that we were recalling those who had left the service and those who were due to retire, particularly at the beginning, that we will ask them to stay back. I mean, extending their tenure, if you like, call it tenure elongation for them. So that is also kind of positive development. And even outside of the health sector, the economy to some extent has benefited because we now have a number of local industries that are producing PPEs, face shields, face masks, even the wares, the boots, local industry, quite a number of them now. And they're producing these PPEs that are as good, if not even better than the imported ones. So I think to that extent, that is something positive. Of course, in the area of research, we have increased our research capacity. You will recall that the Nigerian Institute of Medical Research, NIMA, very early during this pandemic, working with the Center of Excellence in Ede, they were able to determine the genetic sequence of the virus that we had here at that point in time, and it was established to be the same type of virus that was first discovered in Wuhan, in China, where the outbreak started. So, and it's just not restricted to Western medicine. Even our local practitioners, that is, the herbal practitioners, they have come up with so many products. Yes, we might not have been able to establish that this works for this thing, one way or the other, but the process is ongoing. But so many researches are going on, both in Western medicine and, of course, in our own traditional, complementary, and alternative medicine area. So if you now move on to the negative impact, of course, the one that is very obvious is mortality and morbidity. Sadly enough, we've lost quite a number of people during this pandemic. That's a negative thing. And of course, if you move from that, there are some other reasons that may be responsible for some of these things. And what do I mean? Naturally, what COVID does
COVID is so selfish that it attracts the attention of everyone, thereby diverting attention to other things. The routine healthcare services have suffered. That is the truth. Programs like HIV, AIDS, tuberculosis program, and the like, malaria program, some of these programs, they have suffered. They have not really had the attention. We tried as much as possible to ensure that we do not neglect this program. But in reality, the time, the effort, the attention that COVID-19 is taking out of everyone, not just health workers, is enough to reduce the attention to other disease conditions and programs. Again, if you look at what we've been able to do during this pandemic, when you have a lockdown, when you have curfew, you naturally reduce what people can do. There could have been some cases that could not get to the hospital because of lockdown. There could have been cases that could not get to hospital because vehicles were not available for them. So these are realities, and we just cannot wish this away. Even for the antenatal care, people might not readily go for antenatal care, and people might not even readily go to hospitals because of fear of contracting COVID-19 infection. So a lot of people would rather stay at home because of that fear, which is genuine. A lot of people would not just go to the hospital, they would rather stay at home and try to manage themselves because of the fear of contracting COVID-19. So these are some of the negative impact. Of course, still on the positive side, it just occurred to me that we have increased our virtual engagement. So online engagement for knowledge sharing, for knowledge acquisition and all that, peer review and all that. So we have engaged in things that probably would not ordinarily, but it's the new normal which we have come to terms with. So I think these are some of the positive and negative impacts that we have seen due to COVID-19 pandemic. Thank you very much.
One thing we need to remember is we had a protocol back in September. This protocol required that passengers coming into Nigeria do a test for COVID-19 and have to be PCR negative within 5 days. Not more than 5 days. They have to be PCR negative within 5 days before they can board the flight. When they come into Nigeria, they are supposed to self-isolate for 7 days and then do a repeat test and confirm they are negative before they exit isolation. Nigeria is one of the few countries that has had a double testing policy since September. When the problem arose with the UK and later on South Africa, a lot of countries temporarily banned flights from the UK. And what did they do? They implemented the very same policies that we've had for more than 4 months running. So why would we follow them and ban flights as well if we already have a policy in place that was strict and regardless of the issues of implementation were there and subsequently countries followed us? So in addition to the policy we had, we also put in place additional stringent measures. So one, if you're coming from UK and South Africa, you have to use the portal, you have to pay for the travel test at day 7 after arrival. You have to upload all your documents before you're even allowed to board. So that's in addition to what applies to other countries. And then secondly, we have a register for all passengers coming from the UK and South Africa to enable us actively chase these passengers up and make sure they do the testing at day 7. If by day 10 they do not test, their names go immediately onto our penalty list. We don't even wait until day 14. And then finally, for any passenger coming from these two countries that has a positive result, he's immediately flagged up by the laboratory. The data is sent to NCDC, and his sample or her sample is sent for sequencing. So with all these additional measures, we didn't feel it was really absolutely necessary for us to ban flights from the UK or South Africa simply to copy other nations that were now adopting a policy we've had since September. In terms of lockdowns, I never used the word yet. I didn't say we were not on lockdown yet. I was very careful. So go back and check. You can have the recording again, but I am very sure I never used the word yet for lockdown. So the decision for lockdown is in whose hands? It's not in the PTF's hands. It's in the hands of all of us, the general public. Because who wants to have a lockdown? We know the impact it's had on our economy. We know the impact it's had on the other parts of the economy and the country. It's very difficult. And it makes life difficult for everybody. But the reason why we're worried about the numbers is because at some point, if the numbers continue to trend in this way, our health system will get overwhelmed. And it's not just about those persons that will die from COVID. It's not just the persons that will die from COVID. It's people like you and me that might have other conditions such as diabetes, hypertension, malaria, other treatable conditions that will not even be able to access health services because the health services have been overwhelmed by COVID. So, in as much as I've been told I'm threatening a lockdown, I'm not threatening a lockdown. I'm just saying the fact that we need to comply with these protocols. We need to make sure we use our masks, physical distancing, and hand sanitizers. There are countries in the world that are currently open, very open. Their airports are open, their businesses are open, but they make sure that everybody wears a mask, and they're able to keep the numbers down. And if we do the same, we will be okay. But if we don't, and we get overwhelmed, and we start having huge number of deaths, and the health system is not coping, what do you think will happen? I rest my case. Thank you.
So from what we know right now, reinfections can happen. It's been fairly well documented. To document a reinfection, you have to be sure that it's actually a reinfection and not a case of persisting infection from the first case. So you do that either by virus isolation or sequencing to show that it's a different virus. So that's been demonstrated. It's fairly rare still. The science generally suggests that a second infection is generally milder than the first one. It's also been shown that it's likely that natural immunity for this virus wanes over time. We cannot really know how many reinfections you can have because remember, this is a virus that we've only known for 12 months. So as time proceeds, we will learn a lot more on if you can have multiple infections or just a couple of times, which is what has been documented. We can't know for sure if you can have it severally until we follow people over longer periods of time. But a lot of science is emerging about this. Immunity to viruses is a very complex thing. As we get vaccines, we immunize, we understand the life cycle of these viruses in a lot more detail. But the key message is all of that is academic if we do our very best in terms of what we need to do. For now, even when we do get the vaccine, it will take a while to get to population immunity levels that we require to let down our guards altogether, right? So we just have to face the future this year that we will have to continue doing these things that we need to do. So everything we've been talking about, non-pharmaceutical interventions, we will need to continue. If we reach 40%, which I'm absolutely confident that we will get to, 40% will not be sufficient to get to the levels of immunity on a population basis for us to completely drop our guards. So we have to be honest with each other and say, listen, we'll keep working very hard, but also prepare ourselves for some more prolonged action. But ultimately, like everyone has said here, there are some things that are outside our control completely. You can't stop every single meeting. But for those that can stop, for those that can be done virtually, for the actions that are in our hands, we all need to do what is necessary to be done. Thank you.
Thank you very much.
Of the PTF, I believe I had a question on the palliatives, 4 billion naira palliatives for the industry. The palliative is a policy matter being handled by the Ministry of Aviation. NCA deals strictly with regulatory matters. However, the Ministry of Aviation being the supervisory ministry for all aviation agencies, NCA does get a briefing from the Ministry of Aviation on important issues such as this. Unfortunately, I've been on vacation. I only resumed this morning, and I'm yet to get my handover brief. So right now, I cannot make any comments on this until I go through my briefing tomorrow. Thank you very much.
Thank you very much. The first question was from Nancy. She wanted to know what other conversations we're having around accessing the COVID-19 vaccines. Apart from the COVAX facility, we're also in multiple conversations with the Russians over their Sputnik V vaccine, the Chinese for the Sinovac. We're also having conversations with the United Arab Emirates. So there are multiple conversations that are going on, including bilateral conversations with some pharmaceutical companies. The Honorable Minister of Health is leading on some of those conversations. But really, I think the issue is not about just the timelines for the vaccines to come. We are anxious, we want the vaccines to get here, but we also want vaccines that have been fully certified as safe and potent for use. Some of the other vaccines, candidate vaccines, are still undergoing clinical trials. So as we have those conversations with these multiple entities, we're mindful that it is only vaccines that have gotten approval from stringent regulatory authorities and have WHO support that will be bringing to Nigeria. At a minimum, they should have stringent regulatory agencies that have approved them before they are brought to Nigeria, and NAFDAC can also go through the processes of validating their suitability for use in Nigeria. Then you asked about how we will continue to monitor these vaccines when they get to the subnational level. So with this particular vaccine, NAFDAC will be working with the Presidential Task Force, the NCDC, MPHCDA, and the Federal Ministry of Health to make sure that every vaccine that is packed and is going to be utilized in Nigeria will have a tracing mechanism. So we'll be doing tracking and tracing all the way to when the vaccine is administered. Okay? So we're going to be having those types of data to make sure that there's close monitoring of when the vaccine arrives and when it gets deployed to the field. In any case, even before this particular vaccine, as an agency, we have what we call the Follow the Vaccine initiative, where with the routine immunization vaccines, we find there are ways that we follow up with every batch of vaccine to see when they are deployed to the states, when they get to the local government areas, and when they get to the health facilities. Then you also asked if there will be no need to wear masks. Absolutely not. Of course, after the vaccination, you still need to wear the masks because although you've taken the vaccines, you still are able to transmit the virus. So even in the interest of those people that live with you, those people that are in your neighborhood, it is important that you continue to wear the vaccines and continue all the other non-pharmaceutical interventions. The second question was how we plan to raise the funds for the vaccines. So we have previously mentioned that we're trying to cover 70% of Nigeria's population. Because of the collaboration with the COVAX facility, 20% out of the 70% of the vaccines will be given free of charge to Nigerians. So it's the balance of the 50% that Nigeria will be paying for. And in terms of how we're going to raise the funds, we expect to raise the funds from domestic resources. Then there was a question from the Voice of Nigeria, if there's going to be any strategy to impose vaccination on Nigerians if people resist. I think the message from the Presidential Task Force has consistently been that we will listen to the concerns raised by Nigerians and try the best that we can to explain to them. Once Nigerians are given the information, our experience in the last 20, 30 years with polio eradication is that they usually come around. You have to get the right information and get the right people that they listen to, okay? So for example, it could be somebody who is adducing religious reasons for not wanting to take a vaccine. But if you bring his religious leader, who understands even better than we do to explain that it is not against the religion, then absolutely we find that Nigerians will accept. And I do not think that it will come to a situation where we will ever have to force people to take the vaccines. We're going to work extra hard to make sure that people understand, and I believe that people will come around. And really, from some of the conversations that we had with your colleagues, I think that is very, very possible. So it's not just about the PTF, but this is something that even the media needs to do, right? This is a work that you also have to support us in doing, in making sure the right communication, the right information about these vaccines are out there. And I'm sure that we'll be able to overcome this initial hesitancy that people have just because they don't have a full information around the vaccines. There was a question from NTA, from Ekan from NTA. He asked how much these vaccines cost and how much money we're going to spend. So in terms of the vaccines, there's no doubt about the fact that these vaccines are expensive. So for example, the Pfizer vaccine in the open market costs about $35 US per dose. The Moderna vaccine is about $20 US per dose. The Oxford AstraZeneca vaccine is about $4 per dose, right? So these are quite expensive vaccines. This is why we're using the opportunity of the COVAX that is giving us up to 20% of these vaccines free. Like Economics 101, when the demand is high, the cost will be high. Is that not so? And as the demand, trickles down, we expect that the cost of these vaccines will definitely come down. So it's an evolving situation, and what the Presidential Task Force is doing is also looking and projecting which types of vaccines we're going to be using. Well, right now, it seems the predominant vaccines are the mRNA types, the Pfizer and the Moderna, but in the course of the next few weeks, we believe that there will be more production of the Oxford AstraZeneca, which is cheaper, and by the end of 2021, 2022, we expect that because there will be a ramping up of production, a lot of pharmaceutical companies will, will have more than is required in terms of our needs for vaccines.
So the cost is definitely going to evolve over time, and it's going to be something that that is dynamic, right? So right now we've not zeroed in on the total cost, but there are potential estimates of what this might cost, but we've not zeroed in on how much it's going to cost. And whatever estimates we make now, we know for sure that as more vaccines become available, those costs are likely going to drop. I think pretty much those were the questions that were directed to me. Thank you.
We are gradually grinding
to the question why we have not banned flights. Madam Son, I think you are the one that asked this. Why we have not banned flights from the UK, considering the upsurge of numbers. What I said this evening is, I said it's very instructive to state that factors have contributed to the rise in numbers from late November, included international and local travels, business and religious activities, reopening of schools. A combination of all this without strict compliance with COVID-19 safety measures. So it's a combination of several things. We gradually opened up the space, and there have been movements up and down, activities day and night. That would trigger an upsurge in the figures, because most people have decided that COVID-19 has been defeated with the year 2020. So let's just go to town and behave as if COVID-19 too has gone on leave or is in recession. And that aggravates community transmission. So at every level of our community, as a result of either international travels, local travels, schools and places of worship being open, businesses being open, even where we have not lifted the restriction on nightclubs, bars, restaurants, except for drive-ins and also pickups. All these places are open. All these places are open. But if they were open in a measured and considered way, with strict enforcement of the non-pharmaceutical interventions, we would have been able to moderate the figures and the numbers that we are seeing now. But as long as we don't do that, our figures will keep rising. In 1 week, we moved from 5,000 plus to 9,000. By any stretch of projection, you know that the figure will increase next week. It's not rocket science, it's simple. That's as long as we do not adhere strictly to these non-pharmaceutical interventions and ensure that at the subnational levels there are enforcements. By the time we come back here next week, we'll be reporting something in the region of 15,000 if the figures progress in the manner in which they are progressing. So it's a very serious issue we're dealing with. Dr. Sani has spoken about the reasons why we've not banned flights coming in from the UK, particularly, and South Africa. Well, the measures that we had put in place about 4 months ago is what the world is copying today. It's what the world is copying. I think, with the exception of China, I don't think there's any country in this, that has imposed the kind of strict testing protocols like we have done in Nigeria. And the truth about it is that if our people had been disciplined enough or have been disciplined enough to adhere to these measures, we would have been able to tame this virus. And the truth about it is that we're talking about the UK now is just because of the new strain coming out of the UK. In the last 24 hours, USA reported 213,453 cases. Almost 5 times the number that came out of the UK. So if you're talking about banning, we will ban all flights there. But you see, the fact of the matter is that we are all Nigerians. Let me tell you the street sense, the real street sense that informed part of the decision that we took. If we ban flights coming or going to the UK from Nigeria, all of you will go to Ghana or Benin Republic and board the flight there. We did it before. When Abacha in 1990s, early 1990s, when he banned the flight, I mean British Airways particularly from coming into Nigeria, where were we headed to? But you see, the danger about that is that we will not be able to put in place a comprehensive protocol that can arrest people who would decide to cross the borders, to go on flights, and return through those routes. So in addition to the science that informed the decision, we also had to think smart like Nigerians. Not to give you the benefit of crossing the borders, we can't track you. Travel, come back the same route, we can't track you. And we will have the whole place messed up. So it is better for us to make sure that we put additional protocols in place that will help curtail a new resurgence of a variant that we do not know its characteristics like the first one. And that's why you can see that there were additional protocols that have been put in place with regards to flight from the UK and South Africa. I can assure you, when we did not open our airspaces, a lot of Nigerians were coming in through the neighboring countries. And there's no way, I know, there's no way we can stop Nigerians from going to the UK. If you say, okay, direct flights from the UK will not come in, British Airways will not come in. We'll go on Ethiopian Airlines, we'll go on Turkish, we'll go on Emirates, we'll go on all the other flights. The destination will still be the same. It's the carrier that would be different. So we have to be smart in that regard. And that was why I said, in addition to the scientific basis of our decision, which cannot be faulted, we also had to apply our street sense in dealing with the affairs of our country, because we know our people very well. I think today we are confronted with truly a very difficult position. Like you had the Honorable Minister of Education rightly said, we had decided schools will open. But in the face of glaring statistics of figures, you heard him say, we'll go back and re-examine these things and see our state of preparedness. The issue of the NIN registration. In spite of all the processes that have been put in place by NIMSI and the Ministry of Communications and Digital Economy, we are still having challenges as to the responses of our people. I can almost bet you that the substantial people that come and congregate in front of NIMSI offices, a substantial part of that number, are not there for the business of the NIM. It's touting and all manners of things. And you see, it's a character flaw that we have taken. For those of you that travel a lot, when you go to the embassies in the morning to queue up for a visa appointment. People turn up there as early as 1 a.m. to take positions so that they can now commercialize those positions in the morning when you are supposed to appear. That is the same attitude. That is the same attitude. A substantial number of those people that appear on a daily basis in front of NIMSI offices have no business there. Have no business there. But we merchandise everything. And in the process, we create a lot of hardships for our people. Wait and see. When the vaccines appear, there will be merchandising even. If I know my people very well. A friend of mine came back from the US 2 days ago, and he was telling me that he took a jab, that he got a vaccine. I said, you are not a health official in terms of age. You are not even 50. How did you do it? He said, do you think these people are different from us? I was shocked. So we have a duty to our nation to continue, particularly those of you of the fourth realm, to push this narrative. The vaccines are safe, they are efficacious. When they arrive, our people should take it. And you've heard from the experts that taking the vaccines alone will not do the job. It must be vaccines in addition to the non-pharmaceutical interventions before we are able to cover about 70% of the population and get to the point of herd immunity, which we expect to get to in 2022. It can't be earlier than 2022 before we are able to get to 70% of the population in terms of vaccination. It comes with a lot of logistics. So let's keep doing this. It's difficult. Everybody is tired and fatigued with COVID-19, but it has made itself so dominant and so relevant that you cannot ignore it. Thank you and have a good evening.
Thank you. With those comments of the chairman, we are gradually bringing today's briefing to an end to allow room for our colleagues to rush to the newsroom. We'll meet again here on Thursday. Good evening.